Hello and welcome to Pulse, your podcast delving into all things health, innovation, digital and data. Proudly brought to you by Pulse IT News. I'm your host, Louise Shaper.
And I'm your co-host, George Margellis.
George, I'm not even sure where to start. Who do I write a strongly worded letter to that how is it already February? That cannot be real. There's been so much happening. I just can't believe it's already February.
I'm sure there's some missing days in January there somewhere that something's gone wrong, but it has been an interesting couple of weeks, hasn't it? I've been glued to the TV watching inaugurations and watching them talk to RFK Jr. It's been a very interesting exercise.
I know. We will probably have to address that on the pod. At the time of recording, folks, the decision has not been made about who's going to run healthcare in the United States. So we will see.
It's been interesting here as well. I mean, I know this morning's Pulse IT, and I know this is Monday morning we're doing this. Pulse IT's Aged Care Edition had a specific opinion piece from Annette Healy from Alain Care around the Aged Care Act. So the Aged Care Act is now going into implementation stage, and it's really interesting times. Caught up with Faith Lavaris last week, and she tells me there's a lot of work going behind the scenes to get everything ready in time. How about yourself? What have you been up to?
Well, I have to tell you a couple of things about the pod. So I have had a couple of meetings and a couple of phone calls, and including by people who I don't know. And anyway, and they've contacted me through, for a work-related reason. And the first thing they say is how much they love the pod, but they want an update on Ripley, like how my dog is going. Okay, well, I've been asked a few times now. So yes, Pulse Potties, Ripley is doing very well. The latest update is Dad has a jelly bean before bed. I don't know why, but anyway, apparently that's a thing. And he now shares half the jelly bean with Ripley. So I don't know what her favourite flavour is of jelly bean, but yeah, she's having a great time. She's never going to want to come back and live with me, I don't think.
It looks like you've lost the dog to Western Australia. It's settled in.
Yeah, I know, absolutely. My dad rang me last weekend and he's like, I think maybe she should come back to you. And I said, thanks, Dad. But, I think she's doing really important work and she should probably stay with you for a while longer. And he's like, but I'm worried she's going to get too attached. And I said, I think that boat sailed.
Yeah, that's right. When you're sharing half a jelly bean, I think that boat has sailed.
Absolutely. Absolutely.
Who gets the first bite?
I didn't think to ask. I don't even want to know. Oh, my God. Anyway, so Ripley's doing well. And then the other thing, George, which I thought was pretty funny, this podcast, we know, people like it. They tell us, which is great. And thank you, everyone. I'm glad you're enjoying it and telling your friends. But I didn't realise we have some power, George, that I didn't know we had. I was reflecting over January and with all the announcements that Trump's been flooding the news with. And one that I don't think anyone expected was invading Greenland. He's going to take over Greenland. And my mind went back to the interview that we did with Matthew Holt. And you might recall that Matthew Holt suggested that the US should invade Denmark so that they could take Novo Nordisk and basically own all of their GLP-1 manufacturing. Well, I didn't realise people in the Trump administration were listening to the pod and they've taken Matthew's advice to heart.
It starts with Greenland and then you just move on into Denmark. Where have we seen this story before?
I know. Anyway, yes, Matthew Holt. There you go.
Matthew's always been a pretty good forecaster. He does have his fingers on the pulse.
Yes, if any of the Pulse Potties aren't yet following Matthew Holt on LinkedIn, I suggest you do. Just for the comedy value alone, he actually titles himself, I know, George, you might say that you're a grumpy old doctor, which I completely disagree with, of course, but Matthew, literally his LinkedIn title, as we know, is a healthcare curmudgeon, and he just tells people what he thinks. And, it doesn't hold back, and it's usually pretty funny, actually.
And it's usually pretty accurate too, unfortunately.
Yeah. Okay, we're so much going on in Podland. We should get started with our hot topics. All right, well, first up, George, I thought we would start off with news out of Europe because we don't cover Europe enough on the pod and we're going to modify that in 2025. Well, as reported by Dawn O'Shea in Pulse IT, after a delay of almost a year, the Council of the European Union has officially adopted the European Health Data Space legislation. Now, what this means is that come February, European citizens will have greater control over how their data is used. They will have faster and easier access to their health data, regardless of whether they're in their home country or in another member state. And of course, it's all standards-based with interoperability specified across Europe. Now, George, we love a good standard that makes semantic interoperability possible. And of course, you're also the Australian ambassador for the European Connected Health Alliance here in Australia. What are your thoughts on this, and what are your European networks telling you?
The European health data space is a really interesting concept, and it's designed to make health data more accessible and useful while also protecting individuals' privacy security. It provides hopefully a seamless environment for sharing health data across borders. And in Europe, we're not talking state or province borders, we're talking country borders, so whole new legislations around it. And it also allows them to foster things like medical research, improve quality. It's a really interesting concept, and it's that concept of data portability and interoperability and security and privacy all built into a single space. And the whole thing rests on the concept of a personal health data space. So personal health records are not a new concept. We've been discussing them for many, many years, but they keep on falling into black holes, hitting up against walls. And it looks like our European colleagues have done a lot of work to build a risk-based approach around that enables them to utilize personal data, enable personal control, and yet also have processes so that data can be used for research. And we've seen companies like Novo Nordisk in Europe really drive innovation by using it to that. So I think it's a really interesting concept, watching it with great interest. I'm off to Barcelona later this month for the Digital Health and Wellness Summit, which is being run there as part of MWC. And one of the big topics of discussion there is health data space. I think the fact that they've separated it from the technology, so it's not a technology discussion, it's a standards and process discussion, and now the technologists need to work out how they use it, is really important. So I'll be watching with great interest. I think we've had lots of discussions here about My Health Record is so locked down that we can't use it for secondary use of data and the opportunities we're missing out on. This may be an opportunity for us to leverage some of the work being done there to make things happen faster down here.
Yeah, that's what I was thinking. So we'll cover this topic in future episodes as well, everyone, and let us know if you have specific thoughts on it, and George and I will come back to it. But, one of the things I was thinking, because I can't stand secondary data use, my opinion is if we use the term secondary data use, just by using that term, we're basically saying, oh no, we collect data for one purpose and everything else is secondary, and it should be reversed. It should be, yes, we might be collecting for a specific purpose in time right now, but I've made sure I've got the appropriate consent protocols in place to be able to use that person's data for multiple purposes with their full transparency. But I was thinking with this legislation as well, it'll have significant impacts around that primary, secondary data use, because it'll have to make sure that when you are collecting data, that there is transparency around all the other ways it could be used, and giving patients, citizens the opportunity to opt in for some of that or opt out as they may choose. So there could be a whole other role for data brokers as well in this space.
And look, they're using a risk-based approach. So depending on how that data is going to be used, the degree of data anonymization and privacy security restrictions around it are important. But understanding that the added value of using this data for focused research is something that we really need to get our heads around.
Yeah, that'll be great. All right, well, let's see. Good on you, Europe. We'll see what happens everywhere else.
Hopefully I'll come home with some interesting people from Europe we can talk about in the future about this.
That'd be great. For our next hot topic, well, I should say all of the hot topics, they're all AI related. I can't believe it. There was just, when I started collecting stories for today's episode, at the time, there were some topics that I thought were going to be so huge and we definitely need to discuss them on the pod. Others that, would see what happens. But, today, this morning, when I started putting everything together for this show, George, some of them seem like old news because so much has happened. So I thought we can touch on the key ones.
Definitely.
All right. Well, firstly, in an installment of The Trump Show, a press conference was held at the White House where Trump, OpenAI, Oracle, and basically the money men announced a $500 billion plan to build something called Stargate. Now, for those concerned Gen X and baby boomer listeners, that's Stargate, not to be confused with Skynet, although George is wearing a very appropriate T-shirt today, so I'll let him tell you about that in a second. Now, while OpenAI CEO Sam Altman called Stargate the the most important project of this era. Effectively, it's a series of data centers in the United States. And it is a big deal, of course, because AI needs a heap of space to store data and process data, but it also requires massive amounts of power to run. Now, the project isn't new. Actually, it started with the previous administration was in the White House, but don't let that get in the way of a good opportunity to stand in the room to project superpower status, something the US are frankly masters of the universe at. Now, health was touted as a key beneficiary, with Oracle founder Larry Ellison saying at the launch, Stargate is going to help us cure cancer, amongst other proclamations. Yes, a cancer vaccine. And he said it will be able to be made using AI in about 48 hours after an individual's cancer tumour is gene sequenced. By the way, if you Google Stargate and cancer, you will find the Australian Stargate Project, which is a non-profit about using data to improve prostate cancer awareness. I'm sure they have seen a huge surge in traffic to their website. Thank you, President Trump. George, what about Stargate? What are you thinking?
Well, a couple of things. I mean, first of all, I hope the Australian company gets some of that $500 billion because, they came up with the name first. There used to be a TV show called Stargate. I don't know if you ever saw it. It had nothing to do with AI. It was actually related to time travel. So I'm a little concerned that President Trump may have been confused here and thinks that, he's actually going to be investing in a time travel solution which enables him to go back and maybe even change election results. Who knows? But the name grabbed my attention. But seriously, whenever they announce cures for cancer, I get a bit concerned, and especially when it comes from a technology person rather than a researcher. So if the Australian of the Year, Professor Georgina Long, had said it, I would have said, hey, maybe she knows what she's talking about. She's actually developed some cures for cancer over the years. But Larry Ellison doesn't quite come across as the same sort of a scientific rigor. And I recall I was in the US back in 2013. There was a big buzz then by a guy called Patrick Soon-Shiong, who made a similar announcement, this moonshot for curing cancer by 2020. And I actually sort of, made sure I Googled it before I came across. And of course, in 2025, it doesn't seem to have gone very far. So exciting. I mean, does the world need more data centers? Well, the DeepSeek discussion we'll have later may put a different spin on that. But it's a difference between building a data center is great. Using that data to do things is a little bit more complicated than just, spinning up more hard drives and more processors. And to those people with some money invested in that real estate where those data centers are going, good luck with it, but I still remain slightly dubious.
Yes, fair enough too. If you talk to anyone that works with cancer and has a degree, they all say that cancer's someone's prostate cancer is not the same as someone else's prostate cancer. Like, it's very unique to the individual. It is a very unique thing. The processing power. I am excited though, George, although yes, I agree with you, there's a need to be skeptical with these things, and especially in terms of timeframes when it's like, it's all going to happen, yesterday. But the idea that we could use the processing power and capabilities of AI to deliver cancer and other treatments that are specifically personalized, I don't know how we would do that without this type of technology, just because of the limitations of human cognition.
And we touched on it in our last podcast where we talked about the capabilities of modeling proteins more effectively using AI. So definitely is a tool that's going to be useful, but let's follow the process rather than make the announcements before the fact. The devil is always in the details in these things.
Yeah, that's right. Well, in another AI-related announcement, meanwhile, this is happening in the US, over in Abu Dhabi in the UAE, they announced they are going to spend $3.3 billion. So, only a small fraction of Stargate, but still a lot of money, $3.3 billion, to create the world's first fully AI native city. And when are they going to do that by? 2027. Yes, you heard that right. It's Pulse Potties 2027, 2 years' time, not 2037. They're planning to automate 100% of government processes and create 5,000 jobs. This is going to have significant impacts on their health sector. What do you think about this one, George?
There is a bit of a chest-thumping war at the moment between the UAE and the USA, isn't it? Because they're trying to outdo each other. I was in Arab Health last year, and there were some really amazing announcements made about some of these research initiatives that are happening in the Middle East who still haven't come through. I scratched my head a little bit. So if you automate 100% of government processes, which are currently being done by people, how does that produce 5,000 jobs and not reduce 5,000 jobs? It's a little confusing how an automating of human processes you would think would eliminate jobs, but in this case, it's creating them. But hey, if they can pull it off, throwing money at solutions sounds great. And an AI native city is an interesting concept, but the maths doesn't make sense to me at the moment. But we'll watch with great interest. And, I'm sure if they automate 100% of government process, the easiest way to do that is just say no to everything that's automated.
Yeah, I suppose that's one way to go.
That's one way of doing it.
Yeah. But I guess, like one of the things I found when I first started visiting the United States and, because I've got family over there, and they were still, and I think still some of my family members get paid by physical checks and they don't even bring it home from the office. Like sometimes it gets posted to them. And I'm like, what the hell are you talking about? The rest of us have managed in the world, or most countries have managed to automate, and without AI really, how we get paid. No one actually sees the money unless you're working a cash in a hand job.
Exactly, yeah.
So it'll be interesting to see that one and the impact on the health sector there. And we've just had Arab Health in Dubai. So lots of news coming out of that. We will pay attention to other things that have been happening in that area as well.
It's an interesting place to follow. And like I said, there's some interesting work being done there. But again, what is the value of a city where 100% of government processes are done automatically and then humans need to then fix up what's gone wrong? So we'll watch and wait.
All right, we'll see. And here's an academic study. An AI study from Australian and Indian academics showed a new AI model was able to accurately diagnose 97% of lung diseases. And, we've talked about diagnosis before with AI, but this one's pretty special because it found it could distinguish whether the abnormalities were due to pneumonia, COVID-19, or indeed other conditions. And I believe it's very difficult for a human to be able to just, looking at ultrasounds or these tests to actually be able to tell that difference. You need, further invasive tests. So this would have significant impact for a whole bunch of lung-related conditions.
And this study was specifically looking at the use of lung ultrasounds and being digitally read afterwards. And, ultrasounds are a complex science because they're only as good as the ultrasonographer taking the ultrasound. It is a very manual process. It's unlike an X-ray where you just stand up and press a button. But I think it demonstrates, and we've been seeing this in a number of other studies, imaging is a real sweet spot for AI at the moment. And part of that is because the data is natively captured digitally. It produces a digital data set which can be interrogated digitally much more effectively. This study was interesting. We opened up the study, had a bit of a read around. And one of the big things, of course, is its sensitivity was very good. So it's very good at picking a specific disease. The specificity, on the other hand, which is the detection of false positives, so saying something is a pneumonia and finding out it's not, wasn't quite as good. So that got as low as 80%. There's always been this balance between sensitivity and specificity. You can make things really, really accurate by, if you were to say 100% of scans have pneumonia, then all of the pneumonias are picked up. So your sensitivity in that case is 100%, but your specificity falls off. So we need to measure those, but it is a good example of good research, actually testing the hypotheses, showing the data. I don't know if you actually had a look at the article. It was pretty deeply scientific. There's some really interesting stuff there. So I think it bodes well. And we've had discussions about some of the companies here in Australia that are using imaging as a way in. Again, watch with great interest. But I think the fact that they've actually published their results into that level of detail is a plus.
Yeah. And even where it was published. So this was not from a health journal. This was published in the Frontiers of Computer Science.
Absolutely, yes. I don't know if you had a look at all the calculus in between, but I went straight to the conclusions.
I skipped over that bit. Yeah. I'm just like, I'll trust this has been peer reviewed by someone who actually understands all of that, which is not me. Yeah. Well, that's cool. All right. Well, also reported by Reach Lyon in Pulse IT, New Zealand, they have launched their public service AI framework to ensure that AI is adopted safely and securely across the country's public service, which obviously includes health, which is interesting because this is happening in New Zealand, but at the same time, the US has decided that deregulation is the best thing for AI development. Ethics and safety be damned. That's ethics and safety, George. It's so 2024, but not in New Zealand.
Our good old friends in New Zealand are really hoping that AI can solve a lot of their problems because, they've pretty much got rid of their whole digital health program team. So maybe AI can replace them. So this may be one of those direct substitution things, but of course, it is always hard to regulate when you have just dissolved your regulation unit. So having this document is great and it shows great intention, but as always, a good document does not replace good implementation. So I think it's important that we publish these documents and then act upon them. And sometimes that means that you need to actually have people on the ground to act upon them. And as we've seen in New Zealand, a lot of those people are come back home to Australia now.
Oh, yes, I know that is happening. And we'll follow that up on that as well. I'm sure Pulse IT will be covering that in terms of, yes, like you said, great to have a document, but who's implementing it and how, and what are the impacts of that, and what are we learning from that process? So I'm sure you'll hear more of that, but good on you, New Zealand. All right, now back over to the United States, George. There is a new healthcare unicorn. They are a startup called Hippocratic AI. Now, Hippocratic AI is not new, but their unicorn status is. Well, they say that they focus on a safety-first large language model specifically for healthcare, hence the name, Hippocratic AI. Last week, they closed a $141 million US funding round to build AI agents specifically for medicine, and it took their valuation to $1.64 billion. Now, my understanding is they don't actually do diagnostic AI, but a whole bunch of other tasks such as medication onboarding and other things. And they've also launched a healthcare AI agent app store. So specifically for clinicians to co-develop AI agents to address specific healthcare conditions and improve workflow efficiency. That announcement has been met with cheers, yay, as well as skepticism from what I can tell online. Which side do you lean on, George?
Well, first of all, on behalf of all my Greek ancestors, I would like to claim copyright on the use of my potentially distant relative Hippocrates. And at least if we can't claim copyright, we at least claim part of the money that's invested in his name. If you're using Hippocrates, throw us a bone. But seriously, I do like their modular approach. So this startup is focusing on specific tasks and looking how AI can benefit those specific tasks, and then how those tasks can be injected into the workflows. So I think it's an interesting concept. They haven't said we're solving all the problems. We're not curing cancer. We're looking for parts of the healthcare journey that can benefit from AIs, making little agents to do so, and providing a way to inject them. The AI agent app store is an interesting concept. I mean, 2007, 2008, when Apple launched the App Store, we all thought, what's an app store? But this idea that you can pick and choose exactly what you need, different organizations can pick different solutions to solve their specific needs, I think is important. I still have some concerns about agentic AI. It requires multiple agents to work together and talk to each other. And we've seen how complex interoperability of data is, yet alone interoperability of black box decisions. So it's something we need to keep at top of mind. But I do like the way they're doing, where they're breaking the problem up into bite-sized pieces, making those bite-sized tools available. And maybe people can build workflows that are more efficient and more effective as a result. So watching with great interest. And if they need to send any money for Hippocrates, I'm happy to accept it on their behalf, and I'll pass it around to my friends in Greece when I get there.
So kind, George. Could you explain agentic AI? Because for a lot of the listeners, some of you will know, others of you won't. But, when we're talking about things like OpenAI, which I'm sure you've had a play with, ChatGPT and other things, that's generative AI. So we're really talking about generating content. But agentic AI is something different, potentially more useful. How would you describe that, George?
I don't claim to be an expert in this space at all, but my understanding of agentic AI is it's very focused AI, which solves a specific issue. And it's almost like an API for AI. So you've got an agentic AI tool, data comes in, the agentic AI tool, the magic it does using AI to solve what the question that the data coming in asking, and sends out an answer. But the idea would be that a number of these agentic AI tools would link to each other to form a almost automated workflow. And each one of those components is potentially a source of error. So my concern is that as you overly complicate a workflow and black box each component of it, we're not quite sure what happens behind the black box. However, if it's low risk workflows, which are going to streamline processes and things like payments and things like referrals and those sort of things, I think it's got great scope. It's just worried that we over-architected so that everything is managed by an agent and no one's quite sure how all these agents are working together. And that becomes my concern.
And obviously we need transparency. It's very easy to feed misinformation into these models as well.
That's right, yeah. If you've got a chain of 20 agents and one of them goes rogue, not necessarily from evil intent, but just, like you said, bad data. Someone's puts the zeros and the ones in the wrong place and the data goes in. You need to be able to track that all the way through, and who's responsible for that ultimate outcome of that process, the risks and dangers of agentic AI, if not properly managed. I guess frameworks and standards become really important here.
Yeah. All right. Well, over to OpenAI. Last week, they announced that they're getting into the science game too. On our last pod, George, we spent a lot of time talking about proteins and put AIs and proteins together, and you can do all sorts of cool things. Well, OpenAI, they've developed a large language model that engineers proteins, which is things like capable of turning regular cells into stem cells. And then speaking of agentic AI, just yesterday, the day before we were recording, OpenAI announced something called Deep Research. Now, it just came out, so I haven't had time to play with it. I've just gone to the site, but it is an AI agent which uses reasoning to synthesize information and complete multi-step research tasks. So things like you might hire a consultancy company to go, oh, could you tell me what's the market conditions for this and what should I do strategically about that? Well, those healthcare consultancies, I think they can prepare for disruption. Like, no one is safe, George. Like, nobody.
Look, it does open up a number of questions for us. And when you look at some of these tools, and now, like DeepSeek, the example, it actually demonstrated that reasoning capability. So that enables people to understand the process. And you're right. I mean, in the past, you would have paid tens of thousands of dollars for these reports, and now they're literally a click away. The protein engineering stuff, the modeling of that is important. The wet lab side of it still needs to be demonstrated. So I think it's really important that collaboration. So just because an AI model says it's going to work, we've often have surprises when we actually try and do it in real life cells. But this sort of reflects on what we spoke about at the last podcast. The integration of science and AI is a real powerful tool. We talk about doctors who use AI will replace doctors who don't use AI. Scientists who use AI will replace scientists who don't use AI. It's going to be an interesting world.
Yeah, certainly massive changes in workflow. I think within 5 years, we'll look back at those discussions that we're having on the pod today and that you all are having around your water coolers and your dinner tables, and we'll go, oh my God, we knew nothing in 2025. Like, the world has changed so much. It's going to hit us quickly. So anyway, we will keep covering the stories as they happen as quickly as we can. Now, over in Australia, we will stick with South Australia Health. A couple of stories there. South Australia have appointed a state minister for AI and the digital economy. I think it's the first one in Australia at a state level. But they've also become the first public radiology provider in Australia to roll out AI as standard across the entire state. This is pretty cool, I think, George. It can change the workflow instantaneously.
South Australia has a strong research culture. The Australian Institute for Machine Learning is based at University of Adelaide, and I know they're involved there. So this is taking thought bubbles and trying them out in the real world and seeing what happens. So hopefully there's a strong evaluation framework behind this, so they're making sure they're getting the outcomes they want and iteratively improving upon it, but scaling out these ideas beyond just research projects into real world environments. And there was a burning platform here for the South Australia. There was reports of x-rays being not read for 120 days in parts of the public healthcare system. There was some real issues around a whole bunch of radiology reports just never being properly used. And so that was the burning platform for them to do this. We'll watch with great interest. Hopefully this will come out with some good reports for Australia to demonstrate scaling up. We've seen some good Australian success stories in imaging, so there may be an opportunity for us to take a world-leading role as long as they don't start adding a tariff to it. But that's another story.
Yes, that's right. A topic for another podcast. Now, we're going to be talking about NVIDIA. Now, George and I have mentioned NVIDIA a few times on the pod because we like to make jokes that we wish we had bought shares in the company before they skyrocketed.
So true.
Yes, if only. Well, anyway, the company, if you're not into tech as much as George and I, they basically make the computer chips that are needed to power the AI. Now, they've announced a couple of stories here. So they've announced that they're collaborating with some other companies, IQVIA, Illumina, Mayo Clinic, and others to reshape the $10 trillion, yes, trillion dollar healthcare industry. They want to advance genomics, drug discovery, robotic surgery, amongst other things. And the media release stated that, and I quote, the convergence of AI, accelerated computing, and biological data is turning healthcare into the largest technology industry. So, just think about that, Pulse Potties. A lot of you who work in healthcare wouldn't necessarily see ourselves as a technology industry, but that's what certain circles are thinking of. And one other story with NVIDIA. So I was reading in the Financial Review, and I'm doing a self-managed super fund right now, and I'm really quite pleased about that because Australian superannuation funds have invested $500 million into the chip maker NVIDIA, which should have been good news, but they did that right before $600 billion US was wiped off its balance sheet. Oh dear. So why did the company tank? Well, that was thanks to a tiny, unheard of at the time, Chinese company called DeepSeek. And DeepSeek is a competitor to all the primarily US-based AI companies. And while it's been around for a short while, last week they announced to the world that their model is basically just as good and so much cheaper than its US counterparts. So you don't need the fancy NVIDIA chips if you're using DeepSeek. DeepSeek is also open source, which allows anyone to use their model to create their own algorithms and models. And within days of the DeepSeek announcement, Pulse IT also reported on something called PatientSeek, which has been built already on the DeepSeek model because, as I said, DeepSeek is open source. I mean, this AI stuff, it's quickly becoming a commodity. I think this type of disruption is just going to become commonplace. And to be honest, soon won't even be newsworthy because it'll be like, oh, I turned my power on today and there was electricity in my house. What do you think, George?
They're both very interesting stories. So NVIDIA is a multi-trillion-dollar company, you're right. And yeah, it is $1 trillion less last week, but still in the multiple trillions of dollars. And big announcements at events like CES are on par for tech companies. And having been involved in one of those tech companies for many years, they do love to make these grand announcements and no details, but we're going to solve a dozen different problems simultaneously. And the companies they're partnered with, IQVIA, Lumina, Mayo Clinic, all well-respected technology companies or healthcare companies. And I know our good friend John Halamka is now over at Mayo Clinic, so he's a strong player in this space, someone we should probably talk to at some stage. However, the mere fact that you have technology doesn't demonstrate you've added value because it's really easy to just add costs by adding technology into a solution. They need to go through that scientifically rigorous process of generating real evidence rather than just making announcements of the potential possibilities of saving the world and doing everything. DeepSeek caught us all off guard. So Monday morning last week when we woke up, every news broadcast, everyone I know was talking about DeepSeek and how it blew away everything was happening. Interestingly, my kids spent a couple of hours trying to get it to admit to Tiananmen Square with no luck.
Oh, yeah, no, you can't do that.
And nor would it answer if China intended to invade Taiwan. However, I do have to say it did a great job. I typed in, I need a one-day itinerary. We plan to go visit Madrid while we're over in Barcelona. Can you give me a one-day itinerary? And he gave me a really good itinerary with recommendations of where to go and how to get from one place to another. So it is pretty cool. Interestingly, once that discussion started petering out, I've noticed there's been a lot of discussion now about okay, how did it develop? How did it sponge off the original OpenAI work? Is it as good as it seems? What are the ethics of storing all the data in a servers in China? There's a whole bunch of other interesting discussion points. So I think we still need to see how it works. But I did try to have a look at PatientSeek. I did see that in Pulse IT, so kudos to the reporters at Pulse IT for finding it. But I do have to admit, I went to the GitHub, I downloaded what was supposedly the code for it and some instructions, but I never quite worked out how to use it. So for any of the technical gurus out there who have got it working, would love to play around with it because the concept of using a low-cost large language model with the degree of accuracy that we seem to be seeing in DeepSeek in healthcare probably opens up a whole new vista of opportunities. And I look at the discussion we had with Alain Labrique, these are opportunities for third world countries who probably jump over some of the steps we've had to take getting to the use of AI, because when the choice is an AI tool or no tool, it becomes a lot easier to make a decision about to use something. So I'll find it interesting. So any of our technical guys out there who have managed to get PatientSeek working, love to hear what it looks like and how we can possibly utilize it for, especially in developing economies.
Yeah. Thanks, George. Because I haven't had a chance to have a play with it. I was going to ask you if you had. So, well, it's good you got at least DeepSeek. I would say one thing for anyone listening, the one concern with DeepSeek is, of course, your data is stored on servers in China. Now, maybe that's cool for your holiday itinerary to Madrid, George. And to be honest, most of the things that I use it for, those tools, I would be okay with that. But if you're looking at sensitive data, especially patient data has and sensitive type of data, there's a whole bunch of Australian legislation that means those servers need to be held in Australia on our shores and subject to Australian laws, which I imagine this would not be since the servers are not in Australia.
Again, I don't know whether I feel more confident whether it's an American server versus a Chinese server at the moment. I tend to think that
Yeah.
I may need to put that server under my desk back in the good old days.
That's right. Well, and George, the last story we have is a very brief one. Look, it's basically just good news. It's good news. The World Economic Forum happened in Davos, and the CEO of Anthropic AI company, Dario Amodi, he made an announcement, and he announced that AI is going to enable us to double human lifespans, and it's only going to take 5 to 10 years to do it. So, I'm like, oh, this is great. So what does that mean? Doubling, I think now as a female, I'm looking at 86. So what's doubling of 86? A lot more than that.
Yeah, 172.
I think I might actually be alive to see Elon land on Mars.
Absolutely, absolutely. We may have to go with him because, there's not going to be any room here for anyone else to sit around. Again, I think it's very exciting that Dr. Dario Amodi, a PhD in physics from Princeton, somehow has worked out how we're going to make us live to about 160. That's interesting. My main concern is my superannuation is not going to get me to 160, so I'll need to work out whether he can work out a way of doubling my money as well. And if he can combine those things, we're on a winner. You and I have had lots of discussions around this longevity stuff. It's a really hot topic at the moment. And we've seen interesting studies where they talk about incremental increases. Interestingly, a couple of years ago, I did see someone telling me that we're going to defeat death, so we're going to live in an infinite time period.
God, please no.
I struggle with the mathematics of how we're going to get an infinite number of people living an infinite lifespan on a finite world, which is already falling apart. But if the AI can somehow do the exercise for me, stop me from eating the fast food, keep my life stress-free, it may well give me a few more years, but doubling sounds hyperbolic.
It's crazy, isn't it? I mean, we've talked about the Commonwealth Fund report on a previous pod, and that report, as well as heaps of other studies, show that America, they have the worst lifespan amongst any modern economy. So, I think it was something like, as a female, I'm looking at 86 to die as an average age, whereas in the States, it's like 80, I think. It's significantly different. It's not just a few months. Anyway, and I was like, well, why is that the case? Because we have the same amount of research, the same access to data and information as in the States than you do in Australia. On lots of fronts, America has the world leading research on a whole bunch of medical conditions and things. So why is it different? And it's different because, like you said, George, humans, we know better. We all do things, whether you're a smoker or whether you just didn't go to the gym today when you know you should, or you had that second serving of ice cream. Like, we make these sorts of choices for ourselves, and we don't do it in the absence of better information. We go, I know I shouldn't eat that, but I love it. I'm going to eat it anyway, and I'll go to the gym tomorrow. So we have all the same information, and yet individual decision making and policy decisions are not necessarily influenced by the best available research that we have now. So unless AI can crack human behavior, I don't see how it would be possible to even add 20 years to our lifespan, let alone doubling it.
Once your AI starts working directly with the Neuralink, I mean, there's all these potential possibilities. All these things come into play, but the reality is human nature is human nature, and AI may provide us with more information and better information, acting upon that information. And we're still very much at the moment separating AI hype and AI reality. The classic Gartner curve has had its peak extended by AI, I think, and that its inflated expectation peak is going on much longer than we would expect. One good thing that I'm seeing now is we're starting to see the number of reputable medical journals now publishing specific AI editions. And when you read the articles in those AI editions, they bring you back to reality. So they start talking about very, very basic modifications using AI and research doing AI. So we just need to balance the hype with the reality. And as always, go back to those peer-reviewed scientific journals where people demonstrated accurately what's possible. Nature Medicine is a classic example. They have some great articles there about AI, and they demonstrate 5% improvements, not 500% improvements.
Yeah. So George and I, we're landing on the skeptical side of this announcement. But, I'm sure amongst other things that were said at the World Economic Forum, that's probably not the most outlandish one. So we'll see.
But when we are doing our podcast in 21, 25 together, as a result of this, we will reflect back on our good friend Dario and thank him for the 110,000th edition of the podcast being published because of our 160-year lifespan.
That'll be brilliant. Okay, I look forward to that episode, George. All right, now it's time for us to take a break. When we come back, we are going to play you part 2 of our interview with Alain Labrique because it was just too good. So we wanted to play you it in its entirety. You heard part 1 on the previous episode, and today we're bringing you part 2.
Looking forward to that. The other thing, of course, is empowering consumers and making sure they're part of this journey. So it's not just a clinician or a bureaucracy-led initiative. And I know you have things like the Global Digital Health Certification Network. How does that work to enable both cross-border health sharing, but also consumer engagement in the projects?
Thanks, George. I think that's really exciting to talk about because if there's 2 3-letter words that I would like folks to take away from this conversation, the first is DPI, digital public infrastructure. And that's the sort of foundations on which successful digital ecosystems are built, right? Not digital systems, but digital ecosystems. Because if we truly want to have a person-centered digital transformation, we have to be thinking about what is convenient to the person. As individuals, as we go through our health journeys, we should have the ability to access our health record. We should have the ability to move from one provider to another as we experience different things in life, an accident one week and a diagnosis of a chronic disease another week, hopefully not week after week, but, in our lifetimes. And it would be nice for that information to be portable from provider to provider. And the DPI, the digital public infrastructure, whether it's digital identity, the ability to make digital payments, or even the backbone registries, the persistent health records, the provider registries that keep all this information updated as part of digital commons that benefits everyone is really critical. Because we realize that, if we're going to approach this in a piecemeal, vertical way, everyone ends up wasting a lot of resources building these pieces that should be built once and used multiple times. Each of the developers ends up building those pieces over and over again. Imagine if every car manufacturer had to build their own highway, or every train manufacturer had to build their own railway tracks, right? We're living in a nightmarish world. That's just not how infrastructure works. So the first word would be digital public infrastructure. And that will bring me to the question that you just asked, George, about the Global Digital Certification Network. But the second word that I'd like folks to remember is PHR, personal health records. Because combining DPI and PHR is the magic formula. And that's what the Global Digital Certification Network has done. Coming out of the pandemic, we realized that building a plane while flying it is certainly not the optimal way of getting from A to B. And so there's certain sort of precursor infrastructure that, if it exists, can unlock and enable people to have access to and be the custodians of their own health records. The information about their health that really should be a right for you to have and access when and where you need that information. And so during the pandemic, many of listeners will remember, if you happen to be in a place, your country had made bilateral agreements or multilateral agreements with other countries to agree to use certain standards to present a QR code when you were traveling from one country to the other to certify that you had received a vaccine or you had received a negative test to demonstrate your COVID status. Well, we realized that the inefficiencies of countries having to scramble to establish those partnerships during a crisis was no way to have resilient global health systems. And so in 2023, WHO took on the responsibility, based on the mandate from member states, to help create resilient global architecture that can empower people to be the custodians of their own health record. And so we stood up the Global Digital Health Certification Network, which today has over 80 countries as participants, that effectively covers nearly 2 billion human beings who now can have access to their health record and carry that record with them to share with whichever providers they see fit as needed, as for medical tourism, for religious pilgrimages, for whatever purpose. We've even had large countries come to us and ask, while we're working on improving interoperability between hospitals, can our patients be empowered by a personal health record that is verifiable using the WHO network so that they can port their information from one side of the country to the other side of the country? So, it's been a fascinating experience to see the enthusiasm for this fundamental infrastructure. I'll give you a most exciting thing and why I was in Riyadh last week. Last year, WHO, working with the Kingdom of Saudi Arabia, with Oman, Indonesia, and Malaysia, launched on top of the certification network, the Hajj health card. And in 2024, those countries were able to issue to their citizens almost 250,000 personal health records. So that these pilgrims, so every year, 3 million some pilgrims make this lifetime journey to Mecca and Medina for this apex religious pilgrimage of their lifetimes. And for many people, they've waited their entire life to undertake this journey. So they're usually elderly people. They're people who have a lot of underlying conditions. And the challenge that we heard from physicians in Saudi Arabia was, we get a patient coming in and we have no idea, is this person someone with a heart condition? Does this person have diabetes? Why are they coming in for urgent care? And the course of treatment would be radically different if we had some fundamental information about that person. And so using a new global standard known as the International Patient Summary, based on a FHIR environment, but we were able to work with these 4 countries to demonstrate that WHO certification network could serve as a way to verify the authenticity of that document. So WHO doesn't touch the data or store the data. We just say that this record that you're scanning was actually issued by a certified authority that the government has designated as an authority to issue a health record.
Yep. So you can trust it.
You can trust it because it's a verifiable credential. And so, like your passport, when you show up at a border, when they scan your passport, they know that this passport was issued by a government authority who has given the authority to issue passports. What this allows people to do now is to verify the authenticity of that record and to make sure that it is accurate information on which they can now base a healthcare decision. And so that's been really exciting to see. And we've had just this year as well, our colleagues in PAHO in the Pan American region announced the Pan American Information Highway, where they will be able to, across all of the South American countries, they're aiming to by 2030, to be able to transact this international patient summary across all of the South American countries as people move from Bolivia to Chile to Argentina to Brazil with that health record that they can be the custodians of. So to me, that is one of the most exciting things that we've been able to do. And as more and more countries come on board to this trust network, what we're doing is we're serving as a very sophisticated phone book. As the anchor of trusted information, we receive from all our 194 countries who is the authorized issuer of one type of certificate or another type of certificate. And then we just push that back out to whoever is creating the systems to read those QR codes to be able to verify, well, this QR code checks out with the trusted authority of Japan or Malaysia or Brazil, and therefore we can use this information with confidence.
That seems so impressive, Alain. And can I ask you to comment? I'm just thinking so many of our listeners will be listening to that and going, wow, that's amazing. I live in a more resourced country than some of the ones you've listed, and I don't have that. There's no international patient summary record. No one's giving me a healthcare passport, as you said. What do you think is the key difference in how the countries that you spend more time with, the ones that are being involved in these initiatives, what would you say are the key differences between them and other more resourced heavy parts of the world that actually still haven't managed to implement this type of really critical infrastructure?
I think we're seeing this change very quickly, Louise. I think across Europe, for example, many countries are looking at making a digital wallet available to their citizens. And a digital wallet is more than just your health record. It's really about having access to your land ownership history, your children's schooling information, your tax history. And so all of these things combined in a digital wallet where you can have access to a lot of e-government services in one place. But many, even high income countries, are passing laws that require health providers to give you access to your health information.
Yes, we're a fan.
As Australia has this digital front door, these movements towards saying, how can we ask people to be active participants in their health if we don't give them ready access to their own health information, right? And so, as someone who in their lifetime, I've had to have a health provider fax, and this was just in the last 5 years, fax my child's health records to the new provider because they didn't trust any other mechanism of transferring that information.
Yeah.
Gosh, this is really pivot point in making that information available. And, I do want to take a moment here because I think it's important as we're talking about all this exciting progress, we still have 2.6 billion people on the planet who are disconnected, who still don't have access to fundamental connectivity, let alone a lot of these sophisticated systems that we're talking about. There's substantial swaths of the world where electricity is still a challenge to get to. And so I do want to just make sure that I give a moment to address the digital divide. And that's something that, we're working very closely with the Broadband Commission through other mechanisms, working with the private sector and the network operators to continuously push the envelope on how we get more people connected. Because, as famously the advisor to the South African Ministry of Health said about a decade ago when we were looking at text messaging programs for pregnant women, he said, access to information is not a privilege, it's a human right. And I think that's really what should be driving us as we think about basic connectivity, because I've seen for myself how a phone call can change the trajectory of whether someone lives or dies. In 2024, moving forward, we should really be addressing these challenges of how we make connectivity universal. But I think you're right, Louise. There are countries where still today you don't have a digital wallet. And I think in the next 5 years, we'll see these things change. And one of the things that I think you can drive is public demand. Because when citizens are asking for this, then governments are more likely to respond. And so I think this podcast and other efforts that you do in terms of creating advocacy among civil society, it's really critical that people are voicing, and youth have a big role to play in this. We work very closely with the WHO Youth Council and other sort of youth movements in health, where they are the ones driving and demanding that these things be available to them as they move into the future.
I'd love to segue into your FIDES program. Am I pronouncing that right? Is it FIDES?
Yeah, FIDES, like bona fides, right?
FIDES, okay. My understanding of that program is about actually empowering and utilizing healthcare influencers on social media as a way of combating misinformation. How does that program work and who came up with that? Because that seems pretty smart.
Yeah, it's a good segue because when we think about that second word I said, PHR, right? Personal health records and how you go through your own health journey, a lot of that has to do with the information that you have access to. And boy, if we didn't live through one pandemic, but two, the second one was an infodemic, as WHO termed it, really a proliferation of false or harmful information that was created with malintent. And so now we're seeing a new term being used, which is not just disinformation or misinformation, but malinformation. Information is created to sow political divisiveness, to sow mistrust in institutions, in science. And this has been a huge concern. And not just during the pandemic, but even before, a lot of difficulties have been experienced to get children vaccinated from preventable childhood illnesses in countries around the world where misleading information has been spread. And that's led to the resurgence of diseases that were eliminated for decades, coming back in high income contexts like the US and parts of Europe. And so this is a real challenge for us. And we recognize that WHO and wonky talking heads don't appeal to everyone. So for us, the importance has been, how do we get trusted information to people where and when they need that information? And so we've actually worked with all kinds of exciting companies and groups who are really at that frontier, whether we're talking about working with big tech companies through our tech task force to present this challenge to them and say, how can you, as curators of search engines, as developers of AI bots, how can you elevate trustworthy information from WHO and make that available to your users? And so several search engine companies and groups like Facebook during the pandemic highlighted WHO trustworthy content as part of the first information that people would see to help make sure they had access to that science-based content. So Fides, as you may know, is the Roman goddess of trust and faithfulness and good faith. So bona fides, that's where that comes from. And so the idea was we have this explosion of influencers, right? People who have millions of followers around the globe who are doing not just the latest dance craze, but they're also doing health content. Clinicians, nurses, midwives who are out there on social media promoting health content. So we said, why don't we team up with them, provide them with content that we feel is important to get out there, whether it's Mpox or flu or whatever priority the WHO is finding from countries that needs to be amplified, and ask those creators to use their capacity to message effectively to amplify that information. And so we have over 1,000 creators around the globe who we help to link up to the various platforms. We just worked closely with TikTok on a global mental health campaign to try and use the TikTok platform that has almost 1 billion followers around the world to reach different segments of the population globally with information that's in a format that they're absorbing and accessing. And so it's an exciting program. It's in its infancy, but if there are social media influencers out there listening to your podcast who say like, hey, I want to be part of that, reach out to the WHO Fides program. And, we'd love to see how you can help us move that forward.
It is exciting to see social networks being used for good rather than some of the purposes they're currently being used for. And just for your reference, the Greek goddess of trust is called Pistis. So you can keep that in mind for your next one.
I don't know, that might go over as well, but maybe.
Look, that's been a fantastic discussion. And, obviously digital health innovation is key. But the one buzzword that you've probably heard 1,000 times this year when you've gone to any health technology conference is AI. So where does AI fit into your big picture? Does it obviously enables us to do things that we've never been able to do before, but then we have the risk of what it can provide, and access to AI also requires access to some high-end technology. And we've seen some discussions recently about the global warming aspects of these large AI server farms. Where do you see AI going from a WHO perspective and from a global perspective?
So George, we could spend another hour on AI. So I'll be very brief. I'll say that WHO is cautiously optimistic about AI. We've been working in the space of AI now for almost 5-6 years. WHO already has guidance on using AI for diagnostic imaging for TB. And I think it's important to differentiate that AI has been a tool in the digital arsenal for quite some time, but that's been what we call probabilistic AI. So AI that's more in the space of machine learning, pattern recognition, model training, and then using those sophisticated computational models to perform repeated clinical tasks. This last 2 years has been characterized by the rapid rise of generative AI that is more human-like in its decision-making, but also more unpredictable. There have been a lot of challenges as people have scrutinized these systems with understanding hallucinations, understanding the representation of incorrect information with a level of confidence that might be associated with a very junior first-year medical student answering a question, but getting it blatantly wrong. So I will say that we see a lot of ways in which AI can accelerate routine administrative functions, summarizing information, putting together minutes or synthesizing large amounts of complex information, or even simplifying clinical messaging for the digestion of a general public or specific audiences. But we are not yet in a place where humans can be taken out of the loop. Even in those simple functions, right? Summarizing information or rewording things to be simpler, you sometimes get things wrong. And in the space of health, we have to have a very high bar of scrutiny, a very high bar of quality. And most importantly, if we go back to the Hippocratic oath of do no harm, we have to make sure that these systems do no harm as they are coming out of the gate, but as they continue to develop and become more sophisticated, that they continue to perform at the levels that we expect them to. So I think there's a lot of hype. There's a lot of enthusiasm around this space because of what we've been astonished to see AI do. But I think there's not a level of scrutiny that needs to happen before these systems are put into practice. And that's where, we have a duty to member states to ensure that technologies that are put into use are safe, effective, and cost effective. And so to your last point about the carbon footprint and the energy requirements of these systems, we're working with a number of academic institutions to explore smaller models that may be more efficient environmentally, but also perform very well in terms of accessing a known set of information and providing recommendations or feedback to people based on that well-boundaried set of information. Right now, you might find interesting, we have a digital information navigator that has been released called Sarah. That is an AI avatar that's available online that is plugged into a language model and that helps people find information around smoking cessation and improving healthier lifestyles that we've worked really hard to boundary to only access certain corpuses of information and to reduce the risk of hallucination. But it's not a perfect system, and we're using it as a way to learn how these systems could eventually be used to deliver information to people.
Excellent. I think it's a great way to wrap up our discussion, is that obviously innovation requires us to experiment, and experimentation also requires us to take some risks as we go forward.
I think on behalf of all the Pulse Potties, they would have learnt a lot. And I'm sure they've all been Googling while they've been listening to look for more information about all the programs that you discussed today. So thank you so much for your time.
Delighted to be with you. And maybe AI can help you to find anything that I've said that makes sense and weed out the things that put people to sleep. Worst case scenario, guys, if you're listening and your kids are having trouble sleeping, just put this on in the background, and my low voice does wonders when I have babies in my arms. Nothing like a digital health lecture to put that 2-year-old to sleep.
It may even incite some young people to get involved in public health, because one of the challenges we face here in Australia is getting even clinicians to get involved in public health. So it's been a really exciting discussion. So thank you very much again for your time, Alain.
Absolutely. Well, thank you all, and look forward to the next time.
Great.
Thanks. All right, George, we're back. Alain, always just such a gentleman, so nice, doing so many good things. It's great to have him on the pod.
An interesting thing about Alain's podcast, we broadcast the first part on our last podcast, and my son was driving home, and shock horror, my kids listened to Pulse Pod, which is interesting.
Aw, hi little Georges. No.
And he actually came back and sort of said, hey, that guy from WHO really knew what he was talking about. I mean, he was really impressed with the discussion. And then, of course, the day afterwards, the United States announced that they're withdrawing from the WHO. So it all seems to be a whole evolving world, isn't it?
Yeah, I did reach out to Alain personally. He just said, hey, I'm really sorry. You probably having not a great week. But, you and I are thinking of him and the team.
Absolutely.
All right. Well, George, in our new segment, recommendations. Do you have any recommendations for the Pulse Potties today?
Look, I touched on it earlier. The new publications coming out from Lancet, from JAMA, from New England Journal of Medicine, and now even Nature Medicine, specifically focus on health AI, are interesting reads. And most of them are still open source documents. So if you get a chance to just flick through those publications to just see where the real research is as compared to some of the hype that's been published is out there is really important. And people like Isaac Kahane and people at Macquarie University, our friends over there, are really doing some great work. So I think get back to the core literature and read those articles. And I'd highly recommend Lancet, New England Journal of Medicine, JAMA and Nature, Digital Medicine's AI supplements.
Oh, thanks, George. Okay, right. And I'll dig up some links to the homepages of those journals as well for the show notes.
What about you? What are you recommending for us?
Well, I had two. My first actually is also a journal article. My God, we're such nerds, George. So, published in the JMIR Medical Education publication is the guidelines for patient-centered documentation in the era of open notes. Now, a friend of PulsePod, Liz Salmi, is one of the co-authors, and of course, we're big fans of open notes here. But this latest publication, which I will put a link to in the show notes, it includes 10 practical guidelines to help clinicians write notes that are clear and respectful. And I'm also hoping that all of the AI scribe companies pay attention to that and read that article and other work that Open Notes does, because that could really be useful to help inform their product development as well. So that was one of my recommendations.
That's a very important point because, again, we're starting to see AI scribes almost becoming commoditized. So the reality is the AI scribe that provides a valuable record versus just an accurate record is going to highlight it. So we really need to leverage some of that work being done by our good friend Liz and others around Open Notes.
That's right. Well, and I had one more recommendation to show that I'm not all about digital health. So this is not digital health related, but it's sort of health related. I wanted to recommend a TV show. I don't know if you've seen it, George, Shrinking on Apple. Have you seen it?
With Harrison Ford.
Yes, with Harrison Ford, and he's probably the big name, but there's lots of others. And for those of you who haven't seen it, no spoiler alerts, but it's about a psychologist and his friends, family and colleagues. And when we meet him in scenes of the first episode, he's basically in the midst of a personal crisis and he's not doing well, even though it's his job to tell other people and help other people over their personal crises. He is not coping well at all. He's not being a good friend. He's not being a good dad. He's not being a good psychologist. And Season 2 just wrapped up a couple of weeks back, and it is such a beautiful story. It's funny. It's a celebration of humanity. And I was thinking about, why do I love this show so much? And I think what makes it special is what makes us as humans special, which is our flaws and the journeys that we go on to do better, to be better, and to be there for others, even to deal with, all the crap that life serves up to us. Yeah. Did you like the show, George?
I've only seen the first two. I haven't got around to watching the second series yet. The problem when you have multiple streaming platforms is you can never quite work out what to do. But yeah, I agree. I mean, it really demonstrates the need for humanity when it comes to these sort of things. So whereas AI can give you a structured plan about how to manage your life, reality, what's that famous saying by Mike Tyson? Everybody has a strategy until you get the first punch in the face. That's the sort of thing that happens in real life, And I think it really does demonstrate that even someone who's trained in psychology and managing anxiety still suffers from anxiety and still suffers from the consequences of that. And we need to understand that when we're dealing with other human beings, it isn't a on-off switch type model. It's a number of processes that can take place. And we're starting to understand that even as you dig deeper into the biological process, it's much more complicated than just on-off. And I think that's what we need to understand.
All right. Well, that's your homework from me then, George, is to watch season 2 of Shrinking because it's just beautiful. I just love it. I especially wanted to mention it because it's very easy at the moment to just, doom scrolling. It's overwhelming. And anyway, I think this show is just such an affirmation of positivity in life. And yeah, I love it. So I hope some of you Pulse Potties enjoy it as well. All right, George, bumper episode. I could talk to you for 3 hours, though, easily on digital health. So listeners, be grateful that it's not a 3-hour podcast because George and I could easily do that. But we look forward to being back with you in the studio in a couple of weeks' time. George, can you read us out, please?
Thanks, Louise, and thank you everyone for listening to Pulse, brought to you by Pulse IT News. Pulse is produced by Ivan Jurek of Octopod Productions. Thanks to Rish Lyon, Dawn O'Shea and Emily Mara for contributing to today's episode. Subscribe, follow and rate Pulse wherever you get your podcasts. You can subscribe to Pulse IT magazine at www.pulseit.news. Send your feedback and questions to pulsepod@pulseit.news. Thanks, everyone.
Thanks, George.